Hey everyone, Greg Staley here from Diverge Media. This is not one you're going to want to miss. We're going to explain to you why the vaccine trials for the COVID vaccine, well, they don't mean a damn thing. I have never been more angry doing any research in my life. What if I told you that the clinical vaccine trials that are currently underway for the COVID vaccine aren't testing to see if they can reduce hospitalizations, ICU admissions, or even the transmission of the virus itself? Well, I'm here to tell you that that is all true. Buckle in, I got a lot to tell you tonight. This is straight from the British Medical Journal itself, titled, "Will COVID-19 Vaccines Save Lives? Current Trials Aren't Designed to Tell Us." This is by Peter Doshi, who is an associate editor at the British Medical Journal. Now, in this article, they put together a nice little chart for us. As you can see, Moderna, Pfizer, AstraZeneca, UK, US, Janssen, Sinopharm, Sinovac. Now, you have the vaccine names, registration numbers, but here's what we're interested in. Down at the bottom here, reduction in severe COVID-19 hospital admission, ICU, or death. No, all across the board. Interruption of transmission, person-to-person spread. No, across the board. Now, I'm just going to read through the things that I think you need to hear from this article. So here we go. Now, in the trials, final efficacy analyses are planned after just 150 to 160 events. That is a positive indication of symptomatic COVID-19, regardless of the severity of the illness. Tal Zaks, chief medical officer at Moderna, told the British Medical Journal that the company's trials lacks adequate statistical power to assess those outcomes. The trial is precluded from judging hospital admissions based on what is a reasonable size and duration to serve the public good here, he said. Hospital admissions and deaths from COVID-19 are simply too uncommon in the population being studied for an effective vaccine to demonstrate statistically significant differences in a trial of 30,000 people. The same is true of its ability to save lives or prevent transmission. The trials are not designed to find out. Zach said, "I would like to know that it prevents mortality, sure, because I believe it does. I just don't think it's feasible within the time frame of the trial. Too many would die waiting for the results before we ever knew that." So let me get this straight. You can't prove the vaccine's actually going to prevent mortality and severe illness because you don't want people to die from the virus? How does this make any sense? I digress, but let me continue. Alright, so what about the interruption of the transmission of the virus itself? Surely the vaccine they're developing should do that, right? Well, let's get at it. Here's Moderna's chief medical officer again. "Our trial will not demonstrate prevention of transmission because in order to do that, you have to swab people twice a week for very long periods of time, and that becomes operationally untenable." Did I hear that right? Is it like you're rushing the vaccine so you can't do the thing that you need to do to prove that it would actually work? Sure sounds like it to me. Now, what about adverse reactions? I mean, at no point in history has there ever been a time where a vaccine was rushed and caused people to be hurt by a vaccine, right? Well, history shows many examples of serious adverse events from vaccines brought to market in periods of enormous pressure and expectation. Sounds familiar, doesn't it? There were contaminated polio vaccines in 1955, cases of Guillain-Barré syndrome in recipients of flu vaccines in 1976, and narcolepsy linked to one brand of influenza vaccine in 2009, the H1N1. Finding severe rare adverse events will require the study of tens of thousands of patients, but this requirement will not be met by early adoption of a product that has not completed its full trial evaluation. This was said by Harvard drug policy researchers Jerry Avorn and Aaron Kelsenheim, who wrote for the Journal of the American Medical Association. Well, surely if anything bad happens to you, you can sue, right? Nope, no you cannot. Isn't this a great system they have developed? Well, then where did Moderna and Pfizer get their 90% efficacy number from? Well, let's go look into it. Very simply, he replied. Number one, we had a bad outcome as our endpoint. It's COVID-19 disease. The Moderna, like Pfizer and Janssen, has designed its study to detect a relative risk reduction of at least 30% in participants developing laboratory-confirmed COVID-19, consistent with FDA and international guidance. Number two, Zaks pointed to influenza vaccines, saying they protect against severe disease better than mild disease. To Moderna, it's the same for COVID-19. If its vaccine is shown to reduce symptomatic COVID-19, it will be confident it also protects against serious outcomes. But the truth is that the science remains far from clear-cut, even for influenza vaccines that have been used for decades. Although randomized control trials have shown an effect in reducing the risk of symptomatic influenza, such trials have never been conducted in elderly living people in the community to see whether they save lives. Only 2 placebo control groups in the population have ever been conducted, and neither was designed to detect any difference in hospital admissions or deaths. Moreover, dramatic increases in use of influenza vaccines has not been associated with a decline in mortality. Whoa. So even influenza, that vaccine that's been around for decades, they haven't actually seen that it reduces hospitalizations or overall mortality? Yeah, but we're supposed to trust those people with the new vaccine that's being rushed, right? Let's read something else from the British Medical Journal on the efficacy of these COVID vaccines. British Medical Journal, rapid response, COVID-19 vaccine candidate is unimpressive. Pfizer's vaccine may be more than 90% effective. We've all heard this. Specific data are not given, but it is easy enough to approximate the numbers involved. Based on the 94 cases in a trial that has enrolled about 40,000 subjects, 8 cases in a vaccine group of 20,000, and 86 cases in a placebo group of 20,000. This yields a COVID-19 attack rate of 0.0004 in the vaccine group and 0.0043 in the placebo group. Relative risk, RR, for vaccination equals 0.093, which translates into a vaccine effectiveness of 90.7%. This sounds impressive, but the absolute risk reduction for an individual is only about 0.4%. The number needed to vaccinate equals 256, which means that to prevent just one COVID-19 case, 256 individuals must get the vaccine. The other 255 individuals derive no benefit but assume all the harm. We've already heard that an early effect of the vaccine is like a hangover of the flu. Let me get this straight. The study designs don't even see if they can reduce the transmission of the virus or if they can reduce the hospitalizations or ICU admissions, yet I'm supposed to be high-fiving people and lining up to get in line for it? It's being rushed. The developers can't be sued, and history shows that there's many problems with rushed vaccines. And on top of all of that, only one in 256 people will derive any benefit from it. Where do I sign up? Where is the mainstream media on this? Heck, where is the independent media on this? It's not like it was hard to find. I read from the British Medical Journal tonight. Now, we need to bring this to the attention of the masses. Because quite frankly, I think the public's being duped into thinking this vaccine is going to be effective when it is anything but. It doesn't matter where you stand on the vaccine argument, the public deserves to know. This is Greg Staley from Diverge Media bringing you the stories that matter. If you want to support independent Canadian media like this that brings you the stories that matter, go to divergemedia.ca and go to donate-to-diverge to support us. Thank you.